learners, you have already learned in the previous session that obesity is increasing and is considered an important non-communicable disease. Many of you may also be aware that diabetes is also on the rise. So in this session, we shall discuss about the preventive strategies that can be adopted both for obesity and diabetes. We have with us Dr. Anupam Prakash, who is Director Professor and Head, Department of Medicine, Lady Hardinge Medical College, New Delhi, who will discuss various preventive strategies that can be adopted for these two diseases. Welcome, Dr. Anupam.
Namaskar, madam. Namaskar.
Okay, so what do you feel, that people should know about these two diseases that you will be talking about in this session?
Very right. Obesity as well as diabetes, obesity or fatness and diabetes, they are two very important things. And I think it is important that each one of us knows about the various aspects of preventing obesity as well as diabetes. So I will start with, if you will permit, I will start with understanding obesity and diabetes, how to prevent them, the nutrition strategies, the exercise or the activity level that we need, and also the various interventions that as an individual, as a healthcare professional, or as at the community or the policy level that we can actually undertake. So I think that should cover most of the things.
So you rightly said, so obesity and diabetes are two very commonly used words and commonly known so-called diseases. But how do we actually define obesity and how do we define diabetes, if you can,
Yes, these are very important things. So obesity in common language, I would say it is any accumulation of fat, but any accumulation of fat is not obesity. So any accumulation of fat which actually translate into adverse health consequences. So that means you have fat in your body which is not essential and is in excess and resulting in health related problems. That is what is obesity. So that is why it is dangerous. The other thing you asked was diabetes. Now diabetes is also very important. That diabetes, again, we all require glucose or sugar in our day-to-day routine. But when sugars levels are high in our blood, when they are not controlled, then actually it is diabetes. So it is basically deficiency of insulin in our body in whatever way.
So many times, we as medical professionals, when patients with diabetes or even patients who are obese who come to us and we, ask them, so they feel that, it's not their fault and they could have done nothing, to prevent their disease, and why they have got this disease, maybe, it is their bad luck, bad karma or whatever. So what are you to say about this?
So this is a very common perception, and I would say that yes, it is half truth, or maybe people at times when they don't want to put in efforts, they actually use the half truth. So yes, there is a genetic component for obesity as well as diabetes when we talk of these things, but importantly there are a number of other factors which we can control. But once we label it as genetics, then obviously it is out of our control, we are not working hard. So there are a number of factors which can be controlled, modified or reverted also, reversible factors also. So they include our day-to-day diet, they include our exercise schedule, they include activity, and a lot of things are actually also related to stress levels also. So these all things can contribute to diabetes as well as weight gain or obesity, and these are all reversible. So it is not right once we say that it is all genes that we inherit or our karma.
So that means we can do a lot of things about, not getting these diseases. But those people who have got these diseases, should they be really concerned? How can these diseases, have an effect on the other organs or on their life, the lifespan, the way they live? How can it affect them?
Now, this is very important for each one of us to understand that obesity as well as diabetes, it is not only just simple accumulation of fat or a little high sugar. Both these diseases are lifestyle disorders. That means these diseases will creep in without telling. So we will already be having a good amount of this disease before we actually know of it. And then we need to actually control it, because otherwise it will keep on progressing. So we need to control weight gain as well as we also need to control blood sugars, because the problem with this is they creep in gradually. The other problem is they affect the whole of body. There is no part of the body which is not affected because of overweight or obesity or because of diabetes. So it is pertinent that we take care of the whole body as well as the predecessors, that means the obesity and diabetes.
So you're talking from an individual perspective or an individual person. But if we talk from a public health specialist point of view, or from people who are program managers who want to talk about how to actually manage them on a global level or a country level or a state level, then what is the incidence or what is the load of this burden of this disease in the community?
Very pragmatic. It is important that yes, it is an individual disease, but not only it is a causing concern for the individual, but it is also a cause of concern for the whole family and for the society also. And person who has obese has implications which affect the day-to-day quality of life. A person who is diabetic also has connotations. It is not only because it is affecting the person, but also because it affects the quality of life. It reduces your productivity also. So again, the life years that the patient has may not be the same as an ordinary person or a non-diabetic, non-obese person. And similarly, the lifespan that is there, the quality of life is also low. And again, there are various statistics which are there. The worldwide, you can have you can say it varies from 1 in 10 to 1 in 4 individuals. Even in India, if you have, we have the ICMR India study which is there. There are other studies also. So the proportion of individuals who are diabetic ranges from 1/3 to 1/4, which is there, which is either overweight or obesity. So it is a huge cause of concern, because people see it as that yes, we belong to a very affluent family, so we are overweight or obese. But that is not the concept. We have to understand that it is changing from a sign of affluence to a sign of disease. So obesity today is a disease which needs to be tackled with, and it is important that you take care of this disease, because otherwise if we have 1 in 3 or 1 in 4 or 1 in 5 individuals who is overweight or obese, that means 1/3 to 1/4 of the population is not having affluence but actually having disease.
And I would go a little further, rather than talking just of affluence, now with that obesity is coming in the adolescent, and if you try to talk to the parents, especially the mother, and you say that your child is obese, so they feel very offended. They say, nahi, hamara bachcha to kuch nahi khata hai. This is all the love that we are giving, we love them, so we give them this food and we give them a lot of food. So that also is a miss.
Yes, this is a very practical problem, and I would say it is a cause of concern, because childhood obesity now is increasing. It is virtually increased 10 times in the last 10 to 15 years. And as you rightly said, to restrict a child, especially for a mother, is very difficult. But otherwise also for the general population or for a family to restrict the child from eating. So it is a two-pronged thing. It is not only the affection of the family in giving things to eat. The problem is again lack of outdoor spaces where the children can actually burn out their energies. So it is a two-pronged thing, and we need to take care of it. It is a very, because a child who is obese today is going to be translating into an obese adult. So that means the disease which was supposed to come at 35, 40 is now coming at 15, 20, 10, 15, which is a very big problem.
So that is what I want our students also to learn more in details. What are the diseases that you feel, there are a number of diseases that with obesity, and especially those diseases are now coming in the adolescent. So in details, if you can tell, what are the systems which get affected and what are the diseases that can, get
See, obesity
affected?
will start from the all organ systems. The most important and which worries most of us is the cardiovascular system. So you have increased propensity to develop heart attacks. Similarly, you have the central nervous system also. There is increased propensity to develop strokes or paralysis. Similarly, you have a lot of cardiac weakness also, which is cardiomyopathies which can be associated. Then the gut also. So you have increased acid formation, you have increased reflux, so patients have heartburn. Then you have a whole lot of constipation. So patients have bowels which don't move normally. So that is again, constipation is one of those diseases. Similarly, with time, patients will develop osteoarthritis. So your knee joints will also give way. Similarly, you have diseases which can result in fatty liver and diabetes. So it is not only failure of different parts because of the excess weight, but the liver, even the kidneys, the chronic kidney disease, one of the risk factors is obesity. So you have diabetes, you have brain stroke paralysis, you have heart disease, you have knee joint disease, you have liver disease. So virtually all organs are affected. And invariably, again coming back to the same thing, if the person is bulky, so it is fat and it is not muscle. So again, the muscular system is also weakened. So in essence, it results, and in fact, long-term studies have shown that obesity also results in cognitive decline. And similarly, diabetes also. Those who are diabetics, they have greater cognitive dysfunction. That means their memory, their intelligence may be slightly lower over a period of time. So it affects virtually every part of the body. It is not a good disease to have.
So you're talking about the physical impact, but does it also have a mental impact? Are there mental diseases also which get associated with obesity?
Definitely. Obesity, you have asked a very pertinent question. Obesity can result with depression, can lead to increased anxiety levels, over a period of time, dementia also. Similarly, diabetes also. So we call it diabetes. There are 3D: diabetes, dementia, depression. So diabetics are more prone to depression, more prone to affective disorders, that means low mood, more prone to dementia also. So it is a, I would say, interconnection which is very vicious, and the right thing is to prevent obesity and diabetes. That is why probably this session has been planned, and rightly so.
So we've talked about what obesity can do to our body and how it can adversely impact us. How can we ascertain if we are obese? Now we are all concerned. We should be concerned. Then how do we know? Do we really have to go to a dietitian or a doctor? Can we, realize that we are obese even without?
See, the simple yardstick and the most accepted across the world is weight, and weight as per the height that we have. So we all understand. So that is what is known as body mass index. I think anybody would just use the internet, and even apps would also tell you. So you should have weight in kilogram divided by the square of height in meters. So if supposing somebody is 60 kgs and the height is 150 centimeters, so 60 divided by 1.5 into 1.5, that means 60 divided by 22, 2.25, so roughly 28. So even a weight of 60 kgs is high for a 5 foot person. So that is what, so you have cutoffs. For Indians, the cutoffs are lower. So it has to be less than 23 kilogram per meter square. So body mass index less than 23 is fine. More than 23 is overweight, and more than 25, more than equal to 25 is definitely obese. So that is the cutoff for Indians. Another thing which is very important, which anybody can do at home also. After taking a bath, before dressing up, or when you are just wearing light clothes, just measure your waist. So maybe it is not a very scientific way, because there are various measures you have to measure at a particular point. But yes, you measure your waist. If your waist is more than 80 centimeters for ladies, more than 90 centimeters for female gents, then definitely it is high. So that is also important, because body mass index, the word used criteria, is standard. You can always measure weight. Everybody knows his or her height. So that criteria, BMI less than 23, is the yardstick that we should follow. But some people who have less BMI or normal BMI may still be having a tummy. So that tummy also is a problem. So that also we should take care of.
So we've talked about this. Now you said there are a lot of modifiable risk factors that lead to obesity. So that means we can prevent obesity. So what are the preventive strategies that you would suggest, for preventing?
Right. So the foremost preventive strategy is diet. That is important. We can discuss it a little more. The other is activity, and with activity, as a part of activity or apart from that, you can talk about exercise. And fourth is stress, de-stressing ourselves. That is very important. These can be done at an individual and a population level both. These are very important strategies.
Okay. So would you like to elaborate on the diet?
So diet is very important, and in a country like India, everything revolves around diet. You already touched upon that topic of adolescent obesity. So even in adults also, diet is very crucial. We have to understand that we should take the right mix. In our 8th class, we are taught about balanced diet. So we have to adhere to it. Now balanced diet, obviously you will not measure it whenever you eat. But as a rule, go off sweets and confectionery items. Take sugars which are, I would say carbohydrates, not sugars, but carbohydrates which are complex carbohydrates. So, which have a good amount of fiber. So, fruits are good, but don't take fruit juices. So, you cannot take concentrated sources of carbohydrates. So, fruit juices are out, and similarly, you should take more of fiber. So, even if you are taking a balanced diet, include a good amount of cucumber, radish, and tomatoes as salads. So, we need to increase our salads in diet. So, green leafy vegetables, salads, these are important.
That too, maybe with the peels. If we eat a
Yes,
fruit,
definitely.
peel.
No, it is always advisable to take the peels because peels have the most fiber. So, if we depeel the fruit before taking, then it is we are actually removing the fiber. So, that is one problem. So, that is why it is important. Take peels, don't take fruit juices. Take the whole fruit. So, that is WHOLE, whole fruit has to be taken. So, without peel doesn't mean it is a whole fruit. So, all fruits, for scientifically, vegetables are also fruits. So, you have to take vegetables as well as fruits, and they are important ingredients. Not as vegetables, because then you add oil to it, which you have to reduce. So, reduce oil, increase fiber, increase complex carbohydrates, go off simple sugars, go off sweets, go off chocolates, go off caffeinated beverages, and when you take, use less of sugar and milk in that. So, those are the yardsticks that you should have. Proteins as pulses is important in diet, and fats I already said, minimize fats. Whatever types, you need to minimize fats.
And like you said, complex carbohydrates would be better. So I think what is the in thing nowadays in fashion, that use of millets rather than a simple
Yes,
refined
millets.
flour. And
Yes, millets, if you can tolerate, very good. But carbohydrates, I would advise that all of us should take regional carbohydrates because we are all used to taking those, and you can modify them. Like people these days get the wheat which is mixed with husk, so that you can take. Brown bread is option is there. So you have a whole lot of options which are there in the market. It just needs a little bit of innovation, even if you are making at home. So, if you are too fond of some things, you add vegetables to it. So, mixed veg is a good option, adding things. So, that pays in the long
so you
run.
talked about proteins and carbohydrates and fats. What about micronutrients or macronutrients? Any role?
So, micronutrients have a very important role, be it vitamins or be it the minerals, manganese, zinc, etc. The best way to take is fruits. So, if you take whole fruits, you will get all the micronutrients. You are taking salads, you will have all the micronutrients. So, that is the best rather than taking vitamin supplements and then having problems. It is always wise because vitamin supplements are concentrated sources of vitamins and minerals, but costly also. And there are a whole lot of substitutes which I don't want to talk about as matter of principle, but they are very costly substitutes. And people go for that. And it is not only micronutrients they provide some things, some heavy metals, etc., which people take, which is actually adverse.
You also talked about physical exercise and physical activity. So anything you would like to comment on that?
So, nutrition alone will not benefit unless until you increase your physical activities. So, everybody has to devise his or her own way. So, when we talk of physical activity, the first and foremost thing is that we should have increase our activity. Even if it is raining, even if we are not able to do, we should do either upper limb exercises or we should use PT exercises are taught in our childhood in school only. You can always do exercises. You move all your limbs, all your joints. And similarly, standing walking is there. You can sit and cycle. You can lie down and cycle. So that is in times when you cannot move out. But it is always advisable you can move out and start walking. Jogging also. But yes, be careful when you walk or jog, you walk on a level surface. We don't want you to or anybody to fall down and hurt himself. So it is always wise to walk on a level field or run on a level field. At times, once you are used to walking or doing a minimum amount of activity, either increase the duration or what you can do is you can go for a more intense exercise. So, go graded, gradually upgrade yourself. You can go for cycling, you can go for swimming, you can go for sports like badminton and tennis. So, they will all be graded up. Don't start practicing on day one. So, that is very important. So, increase activity, Apart from that, once you get into the fold of activity, the recommendation is 150 minutes minimum for 5 days a week in 1 week. So 150 minutes per week is what is recommended. And after that, what you can do is you can go for muscle strengthening exercises also. So that will increase your muscle mass, because when you increase your muscle mass, your fat also is changed to muscle, and you will get rid of fat, which we are all talking about and concerned.
Water is another very important, ingredient that must be included in the diet. Does it have any role, to reduce or prevent obesity?
See, our body is taught, we are taught in third, fourth class also, our body is 60% water. Water is very essential to keep everything running. The blood also is all water, excepting the RBCs, WBCs, platelet, everything is water out there. So, water plays a very important role, and water has to be taken in adequate quantity. Those persons who have kidney disease, blood pressure, or heart disease, or have any end organ failure, they have to be very careful. They should restrict the quantity of water. But otherwise, a normal adult, that person should take at least 1.5 liters of water daily minimum in winters, and increase it to depending upon where the person is in summers. So it should be around about 2.5 to 3.5 liters per day, 24 hours. A young adult has to take this much amount of water, because it increases the efficiency of all systems in the body. So fluid intake has to be monitored and has to be regularly taken. That is very, very important.
Well, this was a third thing which you spoke about, and that was stress. So that is a very $1,000,000 question, how to actually handle stress. But any tips that you would like to provide, about stress, emotional outbursts?
See, stress is a very difficult thing. We have to understand that everybody on this earth has stress, and stress is actually part and parcel of life. Our responses to stress is what actually we need to modulate. So, as you said, we should not get emotionally charged or responsive to all kinds of stress. That is the worst part. So, to go off stress, we need to change our attitude. That is important. In changing our attitude, the foremost thing is to stay positive. And we have to understand that whenever we have negativity, it will come for a transient period, it will go away. So that faith in us will keep us positive. That is one thing, and that will reduce the stress. The other things which we can do, each one of us can do, is practicing yoga, practicing meditation, and even adopting an exercise schedule or an activity schedule. It brings down stress. Spending time with our family, with our peers, having an occupation at hand, or a hobby for ourselves. These are all ways where you can de-stress yourself, and these are very important. And we need to understand that stress is very, very important. We need to reduce our stress levels.
Another very important thing which nowadays is becoming a problem is sleep. I mean, because of the way we are living and because of the types of occupations that are coming, people are working, because we are all one family, one world, one family now. With the, the IT bridging, all time zones have got really skewed now.
And even work from home.
And work from home, of course. So work all the time, that is also happening. So how important is sleep, or do you think that intermittent sleep pattern is a good idea, that catch on a nap and then go ahead? Does that also impact obesity, or do you require at a continuous 8 hours sleep in a day, in which after that you feel freshened?
Well,
What is
that
your
is a very important thing, and I would say sleep is the most important thing in life for anybody. And to promote health, it is important that sleep has to be the most important thing in each of our lives. And no doubt about obesity and diabetes, it is important that you have control of your own sleep, and a minimum 6 to 8 hours sleep is important. Some people would get satisfied in 6 hours, at times less than 6 hours also, but that could be a little or a minor group. But we should aim to get a 6 hour of sleep minimum daily, up to 8 hours, because some people do want a 7 to 8 hours sleep. In 24 hours, the important thing is not about the quantity. Apart from this 6 to 8 hours sleep, it is important that when you get up, do you feel refreshed? So that means you have a satisfying sleep, and you will be able to perform optimally the next day. So some people would like to take power naps or small naps in the middle of the day. So that could be an individual preference, but by and large, you should have a continuous 6 hours stretch of sleep And when you wake up, you should feel refreshed. That is important. Now, the other thing is, if, as you said, IT jobs, BPO jobs, working with teams which are in countries across the world, opposite side of the globe, yes, different time zones, and like work from home, you get an assignment at 10 p.m. at night. These are problems, these are hindrances. Because now the problem is, when you wake during the time when you are supposed to sleep, then it increases not only the hormones which are there in the body, so they get unsettled, so you have a whole lot of obesity and diabetes setting in, plus then you start nighttime snacking. Now, if you are awake for 4 hours at night, not to have anything is not easy, because now your brain is functioning at a time when you are supposed to sleep and there is minimum calorie requirement. Now you are working, your brain is also working. So you will have nighttime snacking, which is again disruptive to the whole body system. So obesity comes in, and then diabetes also comes in. So I would say against it. At times, but it is an individual matter. People have to take it with a pinch of salt and adapt or adopt a different life schedule.
Yeah, and that you have brought up the nighttime snacking. I think even the work snacking and also the TV time or the internet snacking is another one issue which probably adds to the obesity and needs to be cut
So
down.
I didn't touch it, because when you said about adolescent obesity and you talked about that people say they don't take anything and still they get fat. The problem is they don't take the breakfast, the lunch and the dinner proper meals. They don't count what they eat when they are working or snacking and munching. So, and at times when you munch or snack, you don't even remember whether you had one packet of chips or you have two packet of chips, or you have one samosa or two samosas, or you had one jalebi or four jalebis. So you don't count them because you didn't have them in proper meal. So these are the things which actually, when we discuss diet, we should go off. But when you snack, you have all those things only which you go off. People don't stack with kheera, kakdi, cucumber, radish, all those carrots, which they can, yes, if you are stacking with a fruit item, it is good, you can have. But snacking is usually with colleagues and then party time, so which is not good.
So we discussed how to, ascertain whether we have diabetes or ascertain whether we have obesity. Do we require to keep a regular check or go in for screening or monitoring? And who are the people who should actually go in for regular checkups?
Yes, very right, very pertinent. So anybody who has a family history of obesity or diabetes, so that person should be checked every year. Ideally, the recommendation as of now is you should check after the age of 40 years every year if you have a risk factor or if you are already suffering from obesity or diabetes. If you are not having obesity or diabetes in the family or yourself, and you get a screening done at 40 years of age, and then also you are not having any of the disease, then you can get it checked every 5 years. And but now with these rising incidence and prevalence of diabetes, obesity in our community, I think it is pertinent that all adults should screen every 5 years for obesity or diabetes, because I don't think any household is there where the first order relation is not obese or diabetic. So it is pertinent to get yourself checked every year for every 5 years at least, if you are not having diabetes or hypertension yourself or obesity yourself.
So you also talked about obesity preventive strategies. But as you said that there is one component of genetic component also. So there may be some individual, 1% at least of individuals, who trying their best to prevent and trying their best to manage obesity are not really able to manage it. And they are also concerned equally about the health impacts that this obesity can have. So do you suggest that they should go in for some medication or some surgical treatments that are now suggested?
So now if the person is obese, then yes, definitely person should seek medical therapy. If the other therapies have the other lifestyle modifications, nutritional strategies, the activity schedule, the exercise has not worked, then the person should definitely go ahead and seek medical intervention. And today medical intervention and newer drugs which are just come in the last couple of years are as effective as bariatric surgery. So, in fact, if the patient is committed and seeks treatment, he or she may actually not require bariatric surgery. Even medicines would do wonders. But yes, I would like to draw a word of caution. Medicines won't work if the diet and lifestyle or activity is not there. Medicines will work in consonance, otherwise everything will come back.
Coming back to it, at a community level, are there any public health campaigns or any public health, initiatives that can be, because as you also said that both these diseases are rising. So we need to bring in more awareness and we need to bring in more.
So yes, there are a number of strategies which are being planned. The ministry himself, the government of India has set up a non-communicable disease cell only in the ministry, which is in itself means that we are taking the bull by its horns. That is a very important aspect. The other aspects are there are a number of camps, screening camps which are being held. In fact, the schools are also holding very regularly camps also, and they are also having doctors visit them and counseling for obesity and diabetes. And in fact, these days they send the messages to the family also. And with this aspect, even the lunch, there is a green day where all students get only greens. And similarly, many schools have now abolished canteens giving fried and fast foods. So these are ventures which are done at a community level. Even resident welfare associations can take steps. Also, the government has a policy which can be now compared to 2 decades back. If you see, most of the packets will now have the ingredients mentioned. Earlier, nothing was mentioned. So, food safety standards are also there, and a lot many aspects are there at time of policy also and as implementation also. And regular screening health up checkup camps are also being held at a number of places. So there are a number of awareness programs. I belong to Lady Hardy Medical College right now, the place of work. We are holding regular awareness camps in our OPDs and also conducting camps in the vicinity areas, slum areas where people are not there. So these are initiatives which are self-propelled. They are not government propelled, but there are a number of ways we can actually go out to the community and take action.
Yeah, so I think everybody can be empowered and they can spread the message. Whether it is a small group, whether it is even their peer group, it will make a lot of impact.
This program that you are conducting in itself and venture in that aspect only.
So we feel that every student who joins this program is our ambassador for carrying forward this message to wherever they are working and wherever community they are living.
Right.
So I think you have really enlightened us with a lot of important points regarding these two diseases, and I would like you to just summarize, the important points, the messages, take-home messages that you would like to give.
So as you said, enlightened, if everybody is enlightened, my message would be take this forward, you enlighten 10 more people. That is the way the enlightenment of the community will occur. As a parting message, I would just say that a very good initiative, and it is important that we understand that obesity and diabetes, they are both preventable. And it is important to prevent because the incidence and prevalence is rising. We are all affected, and we are all affected because if we are not affected, even one of our relations in the family is affected. That is the gravity of it. And we need to take care of our nutrition, diet that we take day to day, and increase our activity and communicate to others to be able to emphasize that yes, obesity is not a sign of affluence. It is a disease which can have far-reaching consequences, which are all preventable. So obesity and diabetes, control them to prevent complications so that we can have a healthier lifestyle and enjoy our lives.
Thank you very much, sir. Thank you for this nice session.